Hello, my name is Daniel Son, and the drug that I'm focusing on this quarter is venlafaxine. Its most common branded medication is venlafaxine XR or Faxor, which is a prescription-only drug. Faxor was first approved by the FDA in 1997 for the treatment of major depressive disorder, generalized anxiety disorder, and panic disorder. Its therapeutic use for other conditions, such as bipolar disorder and headaches, is under investigation as well. As an SNRI, serotonin norepinephrine reuptake inhibitor, venlafaxine acts on several different neurotransmitters. The serotonin blockade occurs at lower doses than does the norepinephrine blockade, and at higher doses, venlafaxine also inhibits the reuptake of dopamine. And on the left side of the screen is a visual aid of the mechanism of action of venlafaxine or SNRI at the synaptic level. As you can see on the presynaptic neuron, some of the neurotransmitters are here. The serotonin and norepinephrine are the major ones. And as these neurotransmitters are released into the synaptic cleft, some bind to the receptors on the postsynaptic neuron, and some are supposed to be transported or reuptaken by the transporter proteins back into the presynaptic neuron. And that's where SNRIs come into action. They sit on the protein and prevent the blockade and forces the neurotransmitter to go back into the synaptic cleft. And because they're forced back into the synaptic cleft, they stay longer here, which makes the neurotransmitter effects longer lasting and more effective in the long run. So back into the therapeutic use of venlafaxine. In most cases, if it's therapeutic use, dopamine effects are irrelevant, as most of its therapeutic value lies with the serotonin effects of regulating depression, panic, and sleep, and norepinephrine effects to help reduce anxiety symptoms and maintain the emotional tone. There are some significant advantages. Venlafaxine as an SNRI holds over other antidepressants, such as SSRIs, which only increase serotonin levels. For instance, SNRIs lack anticholinergic or antihistaminic effects, which allows their therapeutic effects to occur without disturbing acetylcholine and histamine receptors, which could avoid many unwanted side effects, such as dry mouth, drowsiness, and weight gain. Its dual action on both serotonin and norepinephrine, rather than just serotonin, allows it to have a broader range of treatment scenarios for patients whose symptoms are not sufficiently alleviated by traditional antidepressants. Its side effects are well tolerated, such as nausea, sweating, and loss of appetite, which are some of the common effects of SSRIs as well. And go on to some of the ethical concerns raised around venlafaxine. Similar to that of other antidepressants, as a prescription-only drug, the minimal requirement of access is equivalent to access of physicians and any pharmaceutical supplier with a stock of Effexor. In other words, access may be limited in suburban or rural areas, depending on where the patients reside and their insurance status. Withdrawal symptoms require more attention from both pharmaceutical companies and physicians as well, although the risk of abuse is low, because one advantage of venlafaxine over SSRIs is the well-tolerated side effects. Withdrawal symptoms may feel more intolerable. Its mechanism of action is similar to one of the drugs that we studied this quarter, and that's cocaine. Cocaine also blocks the reuptake of dopamine, norepinephrine, and serotonin at transporters. Some of its effects are similar to the targeted therapeutic effects of venlafaxine, such as mood elevation and increased energy. The key difference, as we have learned, is the activation of reward pathway and the resulting dopaminergic effects, which increases its abusive potential. And here are the references. Thank you for listening.